Hi, everyone. My name is Kimani Woods, and I am the communications manager here at TimeWise Financial. And we are extremely excited to host this Medicare webinar, Guide to Medicare webinar, for you all. And so, as a part of our full service offerings that we have here, Medicare is something that is very important for you guys to have as much information as we can give you about because it is something that is a part of your long-term planning and something that, especially as you're approaching the age of 65, something that you should have as much information and know as much about as you can. So we do have a partner here today who is a licensed healthcare insurance agent, and he is going to be able to share a lot of information with you guys. So if you have any questions, feel free to put them in the chat and we will get to as many as we can at the end of the conversation. So, Matt,
Yeah,
passing it on to you.
awesome. Thanks, Kimani. Colin actually helped me this year when I was needing to navigate ACA coverage for my wife and I. I saw a link to get help from a local agent on the Georgia Access website, where you now go to navigate ACA healthcare, and reached out to Colin, and he went above and beyond and helping me understand the different policies and how each of them worked and making sure I got the policy that was best fit for me. And in our conversations, I realized, he actually did a lot of work with Medicare, not only helping people navigate Medicare, but if and when a supplemental policy was needed, he really helped them navigate which policy aligned with their medical needs, whether it be particular physicians or prescriptions that they take. And so after some conversation, we thought, Medicare is definitely something we're knowledgeable on to a certain degree, but it's not what we do every day as opposed to Colin. So I look forward to letting him share, how to navigate Medicare and some of the tips and common questions he receives so that you guys can make informed decisions as you choose which plan and any supplements are best for you. So take it away, Colin.
Matthew, thank you very much. I really appreciate you guys and all the good people over at TimeWise giving me the opportunity to present a very informational and educational webinar on their Medicare options, what Medicare is going to look like when they turn 65. And, Medicare is a very big decision for a lot of seniors. I know it's a very, very complex system. Luckily, if they work with a licensed agent in their area, that it can make it so much easier. And so that's what we're going to go through today is what it looks like, what enrollment looks like, and all the things in between. So without further ado, I think I'm going to jump right in. I do know a few clients on this webinar of TimeWise are located in Colorado. Luckily, with Medicare, it's a federal health insurance program, so it's just about the same in Colorado as it is here in Georgia. So very similar across the board, really going to be the exact same thing in both states. So we won't have to, there won't be too much of a dichotomy between the states. So I'm going to go ahead and jump right in, and I'll start off with introducing myself. So my name is Colin Meadows. I am with a company called Health Markets Insurance Agency. We are one of the largest national brokerages of health and Medicare related products in the United States. We have around 3,000 agents nationwide and about 100 agents in the state of Georgia, me being one of them. Been doing this for a long time, and I'm really looking forward to presenting some very educational options to the good people here today. So let's jump right in. And of course, on the first slide here, it's very straightforward. It's understanding Medicare, what you need to know, presented by me, Colin Meadows, licensed Medicare agent. Contact info down below. I'd be happy to be a resource for anyone on this call today who has questions about Medicare, is either currently on Medicare or they're turning 65 soon and they're not sure what to do. I like to work objectively for my clients, and I really like to make sure that everyone has a great experience and learns more than anything about how it works and what options are most suitable for them. So let's jump right in and we will go ahead and get this going. Let me make sure here. Great. All right, so before we jump in, I do have some legal required educational disclaimers for everyone. here. This is not a sales presentation. This is strictly educational. Legally, I do have to read all of this off to you guys, so I'll make it real quick. So this presentation is for informational purposes only, and it does not constitute a sales presentation or offer to sell any specific Medicare plans. We do not offer every available plan in your area. Any information provided is general in nature and should not be considered a substitute for reviewing your options directly with Medicare or a licensed insurance professional. For complete details on all Medicare options available in your area, please visit www.medicare.gov or call 1-800-MEDICARE. This presentation is also not affiliated with or endorsed by the U.S. government or any federal Medicare program. And we cannot discuss plan-specific premiums or benefits during this presentation. So it's very general in nature, lots of good education to learn here. So we will go ahead and move on. All right. So part one is going to be enrollment periods, deadlines, and penalties. What does it look like when you turn 65? If you're already on Medicare, when can you switch plans or enroll? Well, this is what we're going to talk about now. So lots of good stuff to look forward to. So a question I get all the time is, what is Medicare? And that's a great question. Medicare is a federal health insurance program for seniors aged 65 and older, and it's a federal health insurance program for certain people who are younger than 65 that have qualifying disabilities, or if you have ALS and end-stage renal failure, also known as an ESRD, which is kidney failure. I don't think anyone on this call has that, which is great, but those are what Medicare is for. Medicare is also managed by the Centers for Medicare and Medicaid Services, also known as CMS. Moving forward here is the biggest question I get: when can I enroll in Medicare? How does it work? Here are the top 2 key dates that you will be entitled to when you are approaching the Medicare age. So the first and foremost, and the most important for anyone who's directly going on to Medicare, is called the initial enrollment period, also known as the IEP. This is for people who are brand new to Medicare. They just turned 65 or they just retired. So the initial enrollment period is a 7-month window. It is 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So you have plenty of time to get your Medicare card and to get enrolled into a plan of your liking. Now, Medicare enrollment most of the time is automatic. Most of the time when people are approaching their 65th birthday, they'll get a red, white, and blue Medicare card in the mail with their Part A and Part B effective date. And other times it's not automatic. Sometimes you have to apply for both A and B. Those are in very, very certain situations. I don't think many of you would be applying manually. It depends on the case, though. We can talk about that more later. The next enrollment period is called the annual enrollment period, also known as AEP. This is for people who are already on Medicare. They're either over the age of 65 or they've been on Medicare for a few years. The annual enrollment period is from October 15th to December 7th every year. Of course, for those already on Medicare, if they want to make changes to an existing plan, or if they want to switch between original and Advantage, vice versa, whatever their heart desires. There will be more enrollment periods that are going to be covered in later slides. These are the top 2 most important to remember. All right, moving on. And what if you miss the Medicare enrollment deadline? This is a big topic. I get asked this very frequently with most of my Medicare clients. So if you do miss the enrollment deadline, a few things can happen. There is a Part B late enrollment penalty. So for every 12-month delay that you have not enrolled into Medicare Part B, it is a 10% penalty for every 12 months. So you would have to pay a 10% fixed rate for every single month until the delay gets satisfied. It's a bit of a convoluted way this works. I try to explain it the best I could. There also is a Part D late enrollment penalty. Part D is prescription drug. We will move into this in later slides with lots more information. So if you enroll into a Part D plan late, you will pay a 1% lifetime penalty. So if you for the amount of time that you do not have creditable drug coverage, that is more to be on that later, but it is a lifetime penalty for Part D late enrollment. And also, if you do miss the deadline, you might be required to wait until the next annual enrollment period to obtain coverage. So it's always best to do it as soon as you turn 65 or 3 months prior, just to make sure that there are no gaps, make sure that there's no issues moving forward. Okay, here we're going to highlight the differences between initial enrollment period and annual enrollment period. We touched on it a little bit a few slides ago. This is going to go a little bit more in detail. So just to recap, the initial enrollment period is for people who are brand new to Medicare, they're turning 65, or they're newly eligible due to a disability or chronic illness. What can you do during the initial enrollment period? You can sign up for Medicare, whatever plan you like. You can choose Original Medicare or Medicare Advantage. We will go into that in later slides as well. And you can add a Part D or Medicare Supplement plan. During annual enrollment, of course, this is for people who are already enrolled in Medicare. What can you do? You can switch from Original Medicare to Medicare Advantage or vice versa. You can change Advantage plans, you can change drug plans, and any changes you make will take effect on January 1st of the following year. Okay, and this is a question I do get asked a lot is, can I enroll before the age of 65? Most of the time, no, but you can in very certain situations. If you have a qualifying disability and you have been receiving Social Security disability income for 24 months, after the 24-month mark, you will be eligible to enroll in Medicare. You could be in your 30s or 40s, even 50s, and if you have SSDI for 24 months, you will be eligible for Medicare. Another way you can get it before 65 is if you have ALS, amyotrophic lateral sclerosis, very, very horrible disease I hope none of you get, or end-stage renal disease, which is, of course, kidney failure. We touched on that briefly. Otherwise, if you're healthy, no Social Security disability income or chronic illness, standard eligibility begins at age 65. All right, so that finishes part one. We're going to move into part two, which are going to be your coverage options, the parts of Medicare, and of course, your supplement options. So let's jump in. So here we're going to take a look at the four most important Medicare parts. There are dozens of parts to Medicare. It can be very tricky navigating all of them alone, which is why a local licensed agent is very beneficial for a lot of people. But these are the top four that are the most important. So Part A, that is your hospital insurance. If you get hospitalized for any reason, Part B is your medical insurance. That's going to be doctor visits, specialist, and outpatient care. Part A and Part B are automatic enrollment before you turn 65. Most of the time, you do not have to talk to Social Security to enroll. It's an automatic process. Then we have Part C here, which is Medicare Advantage. That is hospital, doctor, and prescription drugs. It's an all-in-one alternative to Original Medicare. And then finally, we have Part D, which is prescription drugs. So that covers the most important four parts, A through D. All right, moving forward. So another question I get asked a lot is, what is the difference between Original Medicare and Medicare Advantage? There are pros and cons to both. There are many, many differences to both. This is a very brief overview of the differences between them, so we will take a look at that right now. So the first thing we're going to focus on here is Original Medicare. So the doctor and hospital networks. You can go to any doctor in the United States that accepts Medicare. Over 95% of the doctors in the United States accept Medicare, and the networks are very robust. It's very hard to find a doctor that is not in network. Moving on to drug coverage here. With Original Medicare, you do need a separate Part D prescription drug plan. Extra benefits. Extra benefits with Original Medicare are often not included. Anything like dental, vision, hearing, routine foot care, gym memberships, meal replacements, if you have home health care, anything like that, that's generally not included with Original Medicare. And referrals. Do you need a referral to see a specialist with Original Medicare? You absolutely do not, which is great. Open access. You can go see whoever you want to see as long as they accept Medicare, which most of them do. Moving on to Medicare Advantage here. And of course, this is a very brief overview. This does not cover everything. The doctor and hospital networks, very large networks. Most doctors in the United States accept Medicare Advantage plans. In most cases, you do need to see in-network providers. You can go out of network. We'll touch on that more later. With drug coverage, it is included in Medicare Advantage. You don't have to secure a separate Part D prescription drug plan. Extra benefits, so Medicare Advantage most of the time does include extra benefits such as dental, vision, hearing, routine foot care, or podiatry. If you had a skilled nursing visit and you have to have meals delivered to your home, stuff like that, it does include extra benefits. And with referrals to see a specialist, they are sometimes required, not all the time, depending on what Medicare Advantage plan you decide to secure. So that is a brief overview of the differences between original Medicare and Medicare Advantage, and we'll move on from there. Okay, and another common question I get asked all the time is, do I need a Medicare supplement? And the answer is always yes if you are going with original Medicare, and here's why. Original Medicare, Parts A and B, they cover 80% of all medical expenses. What happens to the other 20%? You're going to be responsible for that other 20% if you don't have a Medicare supplement plan. And I have seen this before. If you had Parts A and B without a supplement and you had a $1 million skilled nursing or hospital claim, that 20%, you're going to owe $200,000. That is a really big deal, a really big thing to keep in mind if you were looking to secure a Medicare supplement. So Medicare supplement plans are also known as Medigap. They fill the gaps of what original Medicare does not cover. They are only available with original Medicare Parts A, B, and D prescription drug, and they cannot be used with a Part C Medicare Advantage plan. Medicare Advantage is its own thing. It has out-of-pocket maximums. It has everything you need. You cannot use Medigap with it. Of course, with that 20% coinsurance that original Medicare you are left with, Medigap will help cover the remaining 20%. And the absolute best time to get Medigap is as soon as you are eligible for Medicare. If you decide to go with original Medicare, you need to get everything done all at once. If there's any hiccups down the road, it could leave you with some very large hospital bills, which are never fun in anyone's case.
Hey, real quick, Colin, on
Yes, sir.
at initial enrollment when you're adding on a Medigap or supplemental policy. I know it's not the case for the actual Medicare coverage, but for the supplemental, is there any underwriting provisions or things like that you have to go through to get approved for the supplemental?
Great question. So when you are newly eligible for Medicare, everything you choose is guaranteed acceptance. There's no medical underwriting. There is no physical or medical exam you need to obtain in order to get those. During that 7-month window of initial enrollment, it doesn't matter what medical conditions you have. You could have stage 4 cancer and you are still entitled to any kind of plan of your choosing. That's why it's very important to get it as soon as you can, because a lot of people, they miss it. They think they might need it. If you wait too long and you have to get back and you want to try and get back onto original Medicare with supplements, you might have to go through a medical underwriting again. So do keep that in mind. The first, when you're initially eligible, you're guaranteed accepted for anything you want to choose.
Yeah, and I'll just add, and it may be, and we can skim over it if it's later in the slides, but we get questions from clients a lot because they hear about this like big decision they have to make once they go on Medicare. Like you don't want to mess it up at initial enrollment because of, like you pointed out, not subject to the underwriting provisions and all of that. There's no hoops to jump through.
Correct.
And that's what they're referring to is deciding, hey, do I want to go on original Medicare or Medicare Advantage? Because if I make the wrong decision, I'm going to have to jump through hoops to get to the other side, whichever change I wanted to make in the future. So,
correct.
Awesome. Thanks.
Absolutely. You're welcome. We will touch a little bit more on that later. So lots of good stuff to look forward to. But thanks for the question. Happy I could answer it for you. Okay, getting into part 3 is the biggest question. What does Medicare cost? Of course, due to compliance, I am not allowed to discuss direct plan premiums with you guys since this is just an educational webinar. I can discuss, however, some of the basic financials that go along with Medicare. So we will look at that right now. So the most common Medicare costs are Part A and Part B. Part A, your hospital insurance. If you're eligible for it, it is covered at 100%. It is $0 a month. Matt, I will let you touch on this a little bit with IRMA, income-related monthly adjustment amount, if you want to take a second to do that.
Yeah, for sure. So yeah, these amounts are essentially the minimum cost for original Medicare. Medicare Advantage have variable costs depending on the particular plan you go to. It's more akin to the traditional insurance you might be used to with an employer with the deductible and all that jazz. But as for original Medicare, there are income related adjustments where if you make over certain thresholds, it usually starts to kick in just north of $200,000 as a married couple, where you actually have to pay a little extra on your premium. The only other piece is oftentimes we see people where they might sell a business or exit a company with a bunch of stock options leading up to the age of 65. And so they have this big one-time huge realization of income on their tax return with capital gains or whatever occurred in that particular year. And if it's a one-off and you don't foresee your income staying that high in the future, um, just to reiterate, Medicare looks at your tax return 2 years back and says, hey, how much did you make? Are you going to owe extra on your premium? But if that was a one-off, you can actually appeal and highlight with some evidence why that was a one-off and get IRMA removed from your Medicare premiums. But in our financial planning with clients, when we're considering things like Roth conversions or how much they should take out of their IRA every year, this is a key consideration because not only do we have to consider taxes on any distributions, but also are they also going to owe an extra, almost like a tax in Medicare premiums that would further throw off the break-even analysis on any of those decisions that we make. So that's one of the real values I think we add in terms of planning around Medicare, whereas Colin adds more of like plan selection and what supplements might be the best. So I think that pretty much covers it. Yeah.
Absolutely, and I really appreciate that. And IRMA is a big thing, income-related monthly adjustment amount. I get asked that a lot. I usually tell people if that you see a very high Part A premium, you can apply for an appeal, which is what you just mentioned. So it's always good to have a financial professional help answer these questions. So I do appreciate that very much. Great answer, Matt. I really appreciate it. So yes, in most cases, Part A is $0 a month. Of course, if you're eligible. Part B, Part B premium, it does adjust every year, and most of the time it is deducted from Social Security checks. Now, if you are not going to be drawing Social Security, it can be taken out via bank draft. For this year, the Part B premium is $185 a month. This does adjust every single year, usually 2 to 3%. It really depends on DC and what they decide to do. Then, of course, we have Part C, Medicare Advantage. The premiums vary by plan. I'm legally not allowed to discuss any kind of plan premiums since we are on an educational seminar here. Part D, prescription drug, they vary by plan as well. Most of the time, they are very affordable. And then Medigap, which is Medicare supplement, those are through private insurance companies, and the premiums do vary. So that is a very, very base level overview of what the costs related with Medicare are. And Matt, I really appreciate your answer with IRMA. All right, and what about deductibles and out-of-pocket costs? This is a big one. There can be a lot of out-of-pocket costs with Medicare, and there can be some deductibles. Really depends on what plan you choose to secure when you're eligible for Medicare. So the Part A deductible, if you do not have a Medicare supplement, the Part A deductible is $1,632 per benefit period, which is January 1st to December 31st of each year. So it's a calendar year. The Part B deductible, which is your doctor visits, it is $240 annually. This one does adjust every year, depending on if you go with a Medicare Advantage or original Medicare with supplements. Some of the supplements can cover that Part B deductible. And there is no out-of-pocket maximum on original Medicare, like we mentioned with Parts A and B. So you will owe 20% of everything unless you do secure a Medicare supplement, Medigap plan. Medicare Advantage, they do have annual out-of-pocket limits. It's very similar to the under 65 health insurance world where you have your out-of-pocket maximum. They are pretty competitive with the under 65 market, so nothing too insane to deal with, which is great. And then Medicare Advantage is not subject to that Part A deductible like we just looked at. So if you do choose for a Medicare Advantage plan, you will not have to pay that $1,632 Part A deductible per year. So that's a brief overview of the deductibles and out-of-pocket cost with Medicare. We'll move forward. Delaying enrollment in employer coverage. A lot of my Medicare or my senior clients who I work with, when they're 65, they're still working, or if they're planning to retire at 70 or 75, very common question I get asked. And they do ask me, will I pay a penalty if I am on an employer plan right now and I choose to secure Medicare later on? And the answer is no. So if you are still working and you have creditable coverage meaning it meets the minimum essential coverage as defined by the Affordable Care Act and Medicare, you can delay Part B and Part D without a penalty. In fact, you can, because Part A is automatic. Most of the time, Part B is automatic. You're already entitled to that. You can delay these if you're still working without a penalty. And when you do decide to retire or you leave your job after the age of 65, you have an 8-month special enrollment period to go ahead and enroll in any Medicare plan of your choosing. So creditable coverage, if you are currently working right now, ask your HR department if it is creditable. Most of the time with employer plans, it is. If it's a major medical plan, then it's creditable. If it's major medical with prescription drug coverage, it's creditable. Very brief overview on this. So yes, you can delay enrollment if you have employer coverage and you choose to retire at a later date. All right, part 4 here is going to be transitioning from current coverage. It's a big one. A lot of people are either on ACA when they're 64, or they're on employer plans, or their spouse's employer plan. And they always wonder, how do I transition from that to Medicare? Good stuff to look forward to here, so we're going to jump right in. A very common question I get asked is, can I have Medicare and employer coverage? And the answer is yes. Many people do. You can have both Medicare and employer health coverage at the same time. The question is, who's going to pay first, Medicare or employer? This question is usually taken up with human resources. This isn't something I would be able to answer in a concrete manner. HR, if you have an HR department, they can handle this for you, but I'm going to give you a brief overview of how it works. So if you work for a company that has 20 or more employees, your employer plan is primary, Medicare will pay secondary. You can delay Part B and Part D prescription drug enrollment. If your company has less than 20 employees, your Medicare will pay primary and your employer is secondary, and you need to enroll in Parts A and B at that time. And of course, always ask HR if your coverage is creditable. Of course, not many people are going to be too worried about how many employees their company has, so that is an HR thing. They can handle all that for you.
And real quick, Colin,
Yes.
uh, in general, I guess, how could it make sense to go ahead and enroll in Medicare if you already have employee coverage? Like, is it maybe if you had like a high deductible health plan, and after you ran it through your employer plan, there was still a big balance due and you have an extra layer of defense, or is that kind of the rationale?
Absolutely. You know, if someone is on an employer plan and they might be spending a good amount of money on it, employer plans, they are legally required to cover 50% of the premiums on a monthly basis. If the price is still coming out to be way more expensive than Medicare and the benefits are just not in their best interest, they can absolutely decide to drop their employer plan and go on to Medicare at any time of the year. So if you do drop your employer plan, that is a special enrollment period, which is great. So yes, you can go on to Medicare if you're not wanting to stay on your employer plan and you want to continue working. That is absolutely an option. Awesome. All right, moving forward here is, can I keep my current doctors and specialists? Very common question I get asked here. A lot of people who are 63, 64, either they're on an employer-sponsored health plan or they're on Marketplace, also known as ACA, Affordable Care Act. Most of the time, their doctors are coordinated with those plans. And of course, you can keep your current doctors. Both Original Medicare and Medicare Advantage have very robust provider networks. In the past few years of doing Medicare, I really haven't seen any doctors that are not in network with Medicare. Very few and far between. So that is something to look forward to. With Original Medicare, you can see any doctor in the United States that accepts Medicare. That, like we mentioned earlier, that is over 95% of the doctors all across the nation. And with Medicare Advantage here, you do need to see in-network providers. However, you can go out of network. Generally, it's a little bit of a higher rate, not by much. It's pretty minuscule. And of course, Medicare Advantage networks have significantly improved over the past few years. I have heard some complaints in the past that my doctors aren't covered, but they have really worked on improving that. So long story short, yes, you absolutely can keep your current doctors and specialists. All right, another great question I get asked, and Matt, I bet you get asked this one too, is what happens to my HSA, also known as a health savings account? So if you have an HSA and you decide to go ahead and enroll in Medicare, you can no longer contribute to your HSA. Once you're on Medicare, you cannot contribute to it anymore. However, you can use your HSA for qualified medical expenses. So you can do both of them, Original Medicare or Medicare Advantage, and using your HSA to get some reimbursement back on any medical claims, you can do that. Only thing, like I mentioned, you cannot do is contribute to your HSA once you are on Medicare. All right, and getting into part 5 here, this is prescription drug coverage. Very important decision for a lot of seniors to make, and we're going to look at that right now. And a very common question I get asked is, do I need a prescription drug plan? You know, I work with a lot of people who are very healthy. I do work with a lot of people who are generally unhealthy. And in every case, I always say yes, get prescription drug coverage. And here's why. Even if you don't take any prescription drugs at the moment, and then a year down the line, you get prescribed an expensive specialty medication, one, you're going to pay the full cost for that amount. And two, once you enroll in Part D, since you didn't get it within the time you're supposed to, you're going to pay a lifetime penalty on it. You're going to pay a 1% penalty of the total premium of your Part D plan permanently. So it's always good to do it as soon as possible. There are low-cost plans available, even if you take very few or no medications at all. It's still good to have it regardless. And in very rare cases, you might not need a prescription drug plan. That is, if you have creditable drug coverage through an employer, or the VA if you're prior military. A lot of retired military personnel, they have VA benefits which have really strong prescription drug coverage that is creditable coverage. So whether you go Medicare Advantage or Original Medicare, you can choose to opt out of prescription drugs if you are part of the VA. Lots of good info here. All right, and another question I get asked is, are my prescriptions going to be covered? That is a very long answer for a short question. So what I always do is I say, hey, I'm not 100% sure. What I have to do is just do some fact finding, look at a few plans and see what would make the most sense for your situation. However, every Medicare Part D or Medicare Advantage plan has a covered drug list, also known as a drug formulary. A formulary is a long 300-page booklet of all the prescriptions that they cover. Generally, they are more robust than the under 65 market. And if you would like to find a detailed list of plan-specific drug coverage, you can go to medicare.gov/plan-compare, or you can search insurance companies' websites to look for their formularies. Of course, talk to a licensed Medicare agent in your area. It's always good to have a resource. Or you can call 1-800-MEDICARE 24/7, and they would be happy to answer those questions for you. All right, another good question here is, what is the donut hole and how does it affect me? Previously, the donut hole was a coverage gap in your prescription drug plans where you would pay a little bit up front, then in the middle you'd pay a lot, and at the catastrophic phase you would go back to paying just a little bit amount. It was a very complex and convoluted system. Luckily, as of January 1st of this year, the Medicare donut hole has been eliminated for Part D plans and is no longer a factor. Thank gosh, I don't have to talk about it anymore because I don't like talking about the donut hole. So that is not an issue anymore. So we do not have to worry about the donut hole. All right, and getting into part 6 here, which are special situations. In very certain situations here, we're going to look at. So what if you are planning to work past 65? We did touch on this a little bit earlier, but I'll just recap everything. If you are planning to work past age 65 and your employer plan is creditable and it works for you and it's affordable, by all means, you're more than welcome to keep it. When you retire and you no longer have employer benefits, you have an 8-month special enrollment window to enroll into a Medicare plan of your choice, guaranteed acceptance, doesn't matter which plan you decide to go through. So when you retire or you leave your job, you have 8 months to enroll, plenty of time. And if you do not have the option of an employer plan, you may enroll at Medicare at the age of 65. So this one is luckily a very, very simple answer. I see we have something in the chat box here. Oh, from TimeWise. Thanks, guys. Excellent. And we are almost finished. We are rounding third right now. Let me go back here. All right, Medicare while traveling. Big question. Traveling internationally, traveling stateside. I get asked this question all the time. It's just about every single week. Someone asks me, what if I travel with Medicare? Great question. So if you decide to go with an original Medicare plan with a Medigap supplement, it can cover up to 80% of international emergency coverage. Depending on what Medicare supplement you choose, they might have a lifetime maximum benefit of $50,000 up to $100,000. But they will cover 80% of international emergency coverage. Hopefully that doesn't happen. Luckily, it is pretty rare, but in some cases, do keep that in mind. Original Medicare offers the same coverage in all 50 states. So if you live in Georgia, you live in Colorado, California, New York, it really doesn't matter where you are. Since Medicare is federal, it's going to cover the exact same things that they say. If you are traveling with Original Medicare and you need to see a doctor, you're good to go. It's the same thing as in your state. And then moving on to Medicare Advantage here, they do cover emergency care with the same coverage as in-network in all 50 states. So if you have an emergency while on Medicare Advantage, they do have service areas, which is usually your state or where you live. Emergency coverage will be covered the same that way. If you do need to see a doctor or a specialist out of your service area, most of the time you'll pay the same copay. It might be a little bit of a higher copay. It just depends on what plan you choose. Let's see. And then Medicare Advantage plans, they do offer international emergency coverage. Generally, it's a little bit of a higher cost. Of course, you have your emergency room copay, urgent care, and hospitalization copays. Generally, they're a little bit higher. Can't get into any specifics, but luckily you are very well covered while traveling, which is great. All right, in Medicare before 65, if you're disabled before the age of 65, here are some of your options. I do get asked this a lot. So if you're under the age of 65 and become disabled, here are your options. You can receive Social Security disability income for 24 months. After 24 months, you will be eligible for Medicare. And of course, as we touched on about twice so far, if you are diagnosed with ALS or end-stage renal failure, you become instantly eligible for Medicare, which is great. If you are under the age of 65 and you're disabled, you have the options of ACA health coverage, your state Medicaid department, and or Social Security disability income. Now, if you do not qualify for SSDI, what you can do is for Colorado specifically, and if you don't qualify for Medicaid, you can go to Connect for Health Colorado. That is Colorado's state-based health insurance marketplace exchange. And here in Georgia, it's called Georgia Access. I work with Georgia Access every single day. So if you can't get on Social Security disability or Medicaid, you do have the option of the Affordable Care Act, also known as the marketplace. All right, and then finally, we have part 7 here, which are other enrollment periods. We talked about annual enrollment and initial enrollment. Here are 2 more we're going to look at real quick. So since we covered AEP and IEP, there are 2 more. So we have open enrollment period here, also known as the OEP. I get asked all the time, what's the difference between AEP and OEP? Good question. We're going to look at that. The open enrollment period is for Medicare Advantage plans, and it allows you to make a one-time change to your Medicare Advantage plan between January 1st and March 31st of each year. So during annual enrollment, if you decide to go with a new Advantage plan and you think, hey, 2 months down the line, I'm not really a big fan, you can make a one-time change to any other Medicare Advantage plan of your choice without any repercussions, which is great. And of course, we did talk about special enrollment period here, also known as an SEP, that allows you to enroll into a Medicare plan outside of the enrollment period due to a special qualifying life event, loss of employment. If you moved from your service area, moved from state to state, that is a special enrollment period. There are plenty of more special enrollment periods. I did want to be pretty cognizant of our time here, so we can look at that at a later date if you'd like. However, thank you guys very much. Now I think we can go ahead and open up for questions, comments, or concerns.
Yeah, first we'll hit Wendy Sue's question here. I believe she's outside the state of Georgia, because I would answer in the state of Georgia, we got a reputable Medicare agent on the line here, but elsewhere, at least in my experience, like going on Georgia Access, there was a really quick and easy way to navigate and see
Yeah.
agents in my area. Do you have any other advice for people in other states in a search of a reputable Medicare agent?
Yes, I do. And there's a couple things I do mention to a lot of people who are either outside of states that I am licensed in, or they're just not sure what to do. If you have friends that are on Medicare and they have an agent that they trust, I would recommend getting their information. Or if you're new to the area, or you're just not sure of who you could go with, I would recommend going to MedicareAgentsHub.com. That'll show you all the Medicare agents in your area. They have star ratings. They're going to look at how reputable they are. I'm going to put that in here in the chat real quick. MedicareAgentsHub.com. That way you can search up anyone in your area, local Facebook groups as well. If you're a part of a community Facebook group, put a post on there saying, hey, I'm looking for a reputable Medicare agent for me turning 65. So there's plenty of ways to do it. Now with the healthcare marketplace, they don't work with Medicare, so it wouldn't be too beneficial to go on that to look for a Medicare agent. So top three are going to be communities, any kind of community Facebook pages you're a part of, MedicareAgentsHub.com, and of course, friends, family who are on Medicare who recommend someone in particular.
Awesome. And then
Yes.
lastly, I'll just say from our perspective, like you might have seen, Joe Namath or another NFL player talking about how Medicare Advantage plans in
Mhm.
general, and the beauty of working with someone like Colin is they can help specify to your particular situation, but in general, Medicare Advantage is more affordable than traditional original Medicare. But if you can afford original Medicare with a supplement plan, it's usually a little more all-encompassing. One other consideration with Advantage plans, because they work kind of like the plans you've used in the past, is they typically have annual resets on out-of-pocket spending and deductibles. So if you were comparing long-term costs and you had a chronic illness of sorts where you knew you would have recurring ongoing medical expenses, that could definitely factor in the decision as well. But that being said, really appreciate you taking the time, Colin, to come on board and educate us and our clients about Medicare and the ins and outs. And I encourage anybody with any questions after the fact or who needs help
Absolutely.
navigating their plan choice to either shoot Colin an email or give him a shout. And as I stated at least in my experience, sample size of one, Colin went well above and beyond to keep me in the loop as to what was going on with my application, as well as navigate each and every plan and get into the
Yeah.
nitty gritty of each plan to make sure it was the best fit for me. So I definitely had a great experience, and if you ever need his services, I hope you have the same. That being said, I think we can wrap it up, and
Great.
thanks for jumping on.